Since the beginning of the pandemic, there has been a lot of information, a lot of misinformation, and a lot of noise surrounding COVID-19. Lately, in New South Wales and across Australia, we've seen enormous surges in case numbers as the Omicron variant begins to take hold. One sentiment that I've encountered in the media and even in my own circles is the idea that mass vaccination hasn't worked. I want to spend the next several minutes talking about this idea using current, real world, publicly available hospital data from around the globe. Hopefully, I can cut through all the noise and deliver some clean, objective, and conclusive analysis. So, the question, in short, can be phrased like this: are COVID-19 vaccines effective against the Omicron variant? Now, there are a lot of ways to approach this question, so I'm going to define some parameters right now. To start with, I won't be distinguishing between vaccine manufacturers, I'll just be talking about them collectively. Secondly, when we talk about effectiveness, there are a number of metrics one could use. In this video, I'm going to talk about infections, that is, someone testing positive, hospitalizations, intensive care, and deaths. Also, because we're limiting this to the Omicron variant, our scope will be limited to recent data, that is, from November 2021 onwards. Now, there are valid and invalid ways to analyze data of any type. So, to be as transparent as possible, I'm going to show you the mathematical approach that I'm taking to present my analysis. Let's begin with an example. In this hypothetical example, we have a town of 100 people. 10 of them are hospitalized with COVID-19. Here, each cross represents one case in hospital. Now, if you know their vaccination status, you could calculate the percentage of hospitalized patients that are vaccinated and unvaccinated. If 5 patients are vaccinated and 5 are unvaccinated, one might conclude that there is no difference between the two groups, and therefore vaccination has no protective value in preventing hospitalization. On the surface, this seems reasonable, but if you have an understanding of population statistics, you'll quickly realize that this approach is deeply flawed. It fails to account for one crucial variable: the vaccination rate of the entire population of the town. In this hypothetical town of 100 people, 90% of the entire population are vaccinated. If the vaccine didn't work, you would therefore expect 90% of the hospital patients to be vaccinated, which is not the case in this example. Now, when I illustrate this, we can clearly see the proportion of hospital patients differs greatly between the two groups, even if the raw numbers or count is the same. This is crucial. We must distinguish between the number of cases and proportion of cases when analysing public health data. 5 people in hospital represents 5.5% of the vaccinated population, as opposed to 50% of unvaccinated. This is a 9-fold difference. One can now validly say, in this population, unvaccinated people are 9 times more likely to be hospitalized with COVID-19. We can also then use these values to calculate how effective vaccination is in keeping people out of hospital. To do this, first, we take the number of vaccinated patients expressed as a proportion of the entire vaccinated population. We then divide this number by the unvaccinated proportion of cases. We subtract this quotient from 1, and we multiply it by 100 to make it a percentage. In this hypothetical, the vaccine is 89% effective, and that translates to unvaccinated people are 9 times more likely to be hospitalized with COVID-19. Now, this is a hypothetical example which provides evidence that vaccines work. Let's have a look at a similar example that provides evidence of the opposite. So, in this town of 100 people, once again, we have 10 who are hospitalized with COVID-19. There are still 100 people in the town. In this hypothetical, however, the vaccination rate is different, only 50%, meaning 50 people are vaccinated and 50 are unvaccinated. Now, the proportion of people hospitalized is identical between the two groups. In this specific hypothetical, there is no evidence that suggests vaccination protects people from being hospitalized. So, if we look at the math, this is how it plays out. We see a vaccine efficacy of 0%. So now, let's compare our two fictional towns side by side. In both towns, we have 100 people. There are 10 patients, 5 of whom are vaccinated, 5 of whom are not. At this point, there's seemingly no difference. However, the vaccination rate is different. In town 1, we have a vaccination rate of 90%, as opposed to only 50% in town 2. As we've seen in the last few minutes, this has a huge impact on the stats. Remember, 89% effective versus 0% effective. Now, hopefully, you understand why it is so crucial to consider the vaccination rate in the population when we present this kind of analysis. If you want to read further on this, I really recommend this great article by Our World in Data. They do a fantastic job at explaining the importance of considering the proportion of cases rather than just the raw number or count of cases. Okay, let's jump into our first real world example. We're going to go to the United States, over to Oklahoma. So the reason I selected Oklahoma is because the data is publicly available, it's easy to find, and importantly, it's stratified by vaccination type. You can find that on page 9 of this document. So these are the data we're going to talk about. As of January 1st, there were 1,226 hospitalizations in the previous 30 days. In that amount, 1,018 were in unvaccinated people. Now, this represents 83% of the total hospital cases. But remember, for this data to be meaningful, we have to calculate the proportion of unvaccinated to vaccinated cases. I've done all of the math here in this spreadsheet. Dividing this rate by this rate, we get the number 6.9. That means in Oklahoma, after accounting for the number of people who are vaccinated or not, unvaccinated people in December were 6.9 times more likely to be hospitalized than unvaccinated people. Using the equations I showed you previously, this converts to a vaccine efficacy of 86% for preventing hospitalizations. For our next case study, we're going to stay in the United States and we'll go to Texas, specifically Amarillo in Texas. So these numbers are from January 14th. Of the 159 people hospitalized, 133 are unvaccinated. The rest of the numbers you can see on screen. Now, when represented this way, the evidence seems to strongly support the idea that vaccines protect people against COVID-19. But remember, for any of this to be valid, we have to account for the vaccination rate. Now, in this part of Texas, the vaccination rate is 49%, so not dissimilar to our last example. So once we convert the raw numbers into proportions, this is how the analysis looks. Here, the vaccine is 80% effective against hospitalization. That means you're 4.9 times less likely to be hospitalized if you're doubly vaccinated. When we look at ICU, the vaccine is 85% effective against severe disease requiring intensive care, which means 6.5 times less likely to be in the ICU if you're doubly vaccinated. Finally, when we look at ventilation, the vaccine is 95% effective against critical disease requiring ventilation. That means you're more than 18 times less likely to be on a ventilator if you're double vaccinated. All right, let's leave the United States and head over to Germany in Europe. So to access this data, it's from the Robert Koch Institute, which you can find here. It is in German, so you will have to translate it to English. Once you've done that, you can then read through, but also more importantly, download this database here, which looks like this. It is in German, of course, so I've curated and translated and cleaned up the data, which looks like this. So when we look at symptomatic cases per 100,000 people, and it's remarkable because in this data set, they've already converted the numbers into proportions, which means we don't have to do that. They've also stratified it by week and more importantly by age. So count on the Germans to be efficient. It allows us, some really specific insights into the effect of the vaccine. So when we look at symptomatic cases, this isn't hospitalizations, this is just cases. We can see that in 12 to 17-year-olds, the vaccine is 82.9% effective. That seems to reduce in 18 to 59-year-old group. However, when we look at this third column here, we see that they've also provided data for boosted individuals. And we can see that the boosted folk have an 84% protection relative to the unvaccinated. We can see a similar effect in 60-plus-year-old group with a 90.8% efficacy of the boosted. Now, keep in mind, this is just symptomatic cases. When we look at hospitalizations, the numbers are a little more encouraging in terms of looking at just receiving 2 doses of the vaccine. So here we can see, if we look at this age group here, so the 18 to 59 age group, we can see that getting 2 vaccinations or being doubly vaccinated gives you an 82% protection against being hospitalized, meaning you're 5.6 times less likely to be in hospital. And when you're boosted, that increases to 92.3. So you now have almost a 13-fold lower likelihood of being hospitalized. So what we can see from this data is that both double and triple vaccination clearly provides a protective effect against both just having a symptomatic case of COVID-19, but more importantly, being hospitalized with COVID-19. Okay, so staying in Europe for our next case study. In the interest of time, I'm not going to show you the math, but we're going to go to the UK, and the stats read as this. In December of 2021, unvaccinated persons were 5.1 times more likely to be hospitalized and 6 times more likely to die from COVID-19. Those are vaccine efficacies of 80 and 83% respectively. All right, for our penultimate case study, we'll be changing continents again and we'll head over to Israel. Data in Israel is superbly well documented. You can see what it looks like here. I'm just going to translate this to English. And you can see they've broken it down into a number of different variables. There's so much data here. It can be a little bit overwhelming. So I've downloaded the data sets that are relevant to this video and I've just converted them into a spreadsheet, which you can see here. Now, to cut the math short, in this data set, 3 doses of Pfizer has a 70% protective effect against hospitalization, with 2 shots providing 41%. If these values seem low to you, I would agree. The great thing about the Israeli data set is that it's stratified by age group, allowing us to evaluate vaccine efficacy based on age. In Israel, a disproportionate number of older people are vaccinated relative to younger people, and also older people are far more likely to get sick and die from COVID-19. So this introduces a bias of sorts that we can't control for when we perform our analysis population-wide. When we look at the data of the entire population without considering age, vaccine efficacy seems low, whereas when we more correctly break it down by age group, we can see the true effect of vaccination. This phenomenon in statistics is called Simpson's paradox, and if you're interested, I really recommend you read this article. It breaks it down really, really well. The reason I'm spending some time on this is because I think we're seeing a similar effect in New South Wales. So this brings me to our last case study, the one closest to home, New South Wales. The data are relatively easy to find from the New South Wales Health website, and it looks like this. So this was published on the 20th of January, and it covers up to the 8th of January. So we're going to work with the data on page 7, specifically table 5, which looks like this. What I've done is I've taken these numbers and I've converted them into rates or proportions using population data, and I've done that on this spreadsheet here. Don't worry, I have a more aesthetic slide coming up. I just wanted to draw everyone's attention to these numbers here. So these numbers compare the rates of COVID-19 cases between the vaccinated and unvaccinated population. This ratio and this negative percentage actually communicate that if you're vaccinated, you're more likely to test positive for COVID-19. And that seems quite strange in context of the previous results. There are a number of reasons why I think this is the case, but that's for another video. If you're thinking that this confirms your belief that the vaccine isn't working, please wait until the end of the video before you jump to that conclusion. Because when we look at hospitalization and ICU, and most importantly deaths, we see a different picture entirely. So between late November and the 8th of January, we had 3,022 people hospitalized with COVID-19 in New South Wales. When we do the math and change the raw numbers into proportions, we see this. Vaccine is 59% effective against hospitalization. That means you're 2.4 times less likely to be hospitalized with COVID-19 if you're vaccinated. When we look at intensive care, this efficacy goes up. It's now 73% effective against severe disease requiring intensive care. That means you're 3.7 times more likely to be in ICU with COVID if you're unvaccinated. Finally, when we look at deaths, 2 effective doses of a vaccine results in an 84% effectiveness. That means you're 6.4 times more likely to die from COVID-19 if you're unvaccinated. Now, relative to the previous locations, these numbers do seem a little lower than some of the countries we've been to. I suspect that we're seeing age as a confounding factor, not dissimilar to what we saw in Israel. However, I don't have access to all of the data and I can only speculate on that. So perhaps I'll make a video in the future about this. Regardless, I think a 6.4 times decrease in likelihood of dying sounds pretty damn good to me. So to quickly summarize the New South Wales data, what we see is that vaccination doesn't seem to provide protection against testing positive, but when we look at hospitalization, intensive care and deaths, there is a substantial protective benefit. So please, if you are unvaccinated and you're watching this video, please go and get vaccinated. It could save your life. That's what the data tells us. The whole world has been ravaged by COVID-19 for 2 years now. Across the world, data are collected differently, vaccine rollouts have been different, and different populations are more or less susceptible to illness. That's why when we're asking a question like, is vaccination working against a global pandemic, it's crucial that we look at data from a global perspective. What we've done in this video is we've looked at data sets from around the world. We saw data from the US, the UK, Israel, Germany, and finally New South Wales. There are more data sets out there for the curious-minded, and you can see some of them on screen now. Overall, what we've seen across these many different locations is that vaccination works. In every location I've shown in this video, and the countless more that I've surveyed producing this video, one thing was remarkably consistent. If you are vaccinated, you are less likely to be hospitalized, less likely to be in intensive care, and less likely to die from COVID-19. So please go and get your booster if you haven't already. Go and get your first and second shot if you haven't already. If you have done these things, rest assured that you've made the scientifically and statistically sound decision, as we've seen in this video. So guys, share this video, tag an anti-vaxxer if you want to. Let's try and cut through the noise and bring some real-world data to the conversation. Thanks for watching.